I am so delighted to be here with you guys today. It has been an honor and a privilege to be part of history. This is a LouVax Mobile Mission. And the LouVax Mobile Mission concept is, as we stand down the LouVax for mass vaccination, is that we're going to be doing these, what I call mini LouVaxes. And it takes all of the things that it took to run LouVax to do this, but in a smaller portion. And so when someone makes a request to the health department that they would like for us to come out and serve a community by providing vaccines or testing, we contact that community leader and schedule it and figure out how many people do they think that they can encourage to come to an event. So we're available to do that. We just need to know where to go. Knowing that, it's a challenge, but we're up for it because that's what needs to happen. The nurses of Kentucky have stepped forward and stepped up. There are 90,000 nurses in the state of Kentucky, and the Kentucky Nurses Association speaks for them and is responsible to them. I want to thank all the organizations that have helped to stand up LouVax as well as the mobile missions, and it has been incredible working with you all to make these mobile missions work. It is a lot of work, but because we want to reach the communities where they work and where they live, people are coming out of the woodwork to make that happen. We've had nurses who have come out of retirement so that they could be part of history, and we've had volunteers who just love nurses who want to help and be part of history. One of the things that Mayor Fisher talked about was KNA will go wherever people are. Well, one of the other things that we will do is to provide education. And Mayor Fisher, based on what you just shared, we're going to have to make you an honorary nurse because he took my whole speech. So all I can say is we want to meet people where they are. We want to be responsive to the questions. And when we find people who have lack of confidence in the vaccines or the process, we want to be there to answer those questions. That's what nurses do. We provide education. Some of the things that we've done is some PSAs to direct them directly to communities who have, and I don't like to call it hesitancy. I like to call it lack of confidence and lack of information, because I was told just recently that when we talk about hesitancy, it almost makes people feel like we're saying they're stupid because they're not doing it. So I want people to realize that we know that there are reasons for lack of confidence in the vaccine, and it's our responsibility to give them the answers. And so some of the places that you can go for consistent information that is correct is to the CDC site, to the Kentucky site, and of course to the Louisville site on the most recent information about vaccines and what people can expect to have happen.
In case that you don't know, the positivity rate in our area is 17.8%. That is huge in relation to the rest of the city. So, listening to the mayor, I listened to you, on Thursday, I was struck by his use of the word reimagining. Perhaps because reimagining means to me, get out of the box that we are in, take the courage to jump and dream impossible dreams. Reimagining for me is seeing investments in public and private in the life of our participants to support the process of integration of the international community. That is not just pay more taxes or make the economy better. It's the continuous process to be fully part of our hometown. An interchange of values, traditions, is a two-road approach. Integration demands more education opportunities for adults, the famous two-generation approach, so our kids have the support to overcome the 72% failure in Jefferson County Public Schools. In one way, the failure is also for the impact of COVID and the families, the lack of knowledge of the system to navigate the school, the police, the health. Reimagine is a dream, and I think, Mayor, that we are ready to take the dream to the next level. I honor to introduce our Mayor, Greg Fisher, repeating his own words. If the last year has taught us anything, is that while we can't predict the future, we must prepare. We must plan and adapt while we cultivate in our community the timeless qualities that will help guide our future: resilience, innovation, equity, and compassion. Mayor Fisher.
Muchísimas gracias, Edgardo. Always a pleasure to be here at Americana. This is one of the great venues in the entire country, and it's run with a heart, a corazón, that's bigger than the entire city. So we really appreciate everything you've done, Edgardo, with you and your team over many, many years here. So good afternoon, everybody, and thank you all for coming out here. It's great to witness the work that's being done with our mobile vaccination strategy. I want to recognize Dr. Sarah Beth Hartledge, where she's over there, yes, keeping a very low profile. And our entire public health team have been through such an amazing journey when you think about standing up Broadbent with the mass vaccination site that we had there. And of course, we'll be wrapping that up, Dr. Hartledge, in the next couple of days, right? Thursday will be the final day at Broadbent, because we're keeping that open so people can get their second shot, and then we'll be fully deployed with our public health department into the community on what we're calling LouVax Mobile. So we're taking the vaccine into the community, much like we're doing here at Americana. So there's a lot of work to do. When you think about us needing to get to herd immunity as a city, we're about 60% there or so. But that first 60% is going to turn out to be a lot easier than this last 40% or this last third. Because everybody that was really anxious to get the vaccine, they've gotten it. Because right now, access and volume is not the problem. It's convincing people that it's safe, it's secure, all the science validates that and shows that, and then making it easy for them. So like coming to sites like Americana. So we're in this phase of the vaccination effort. Before it's all over, we'll be going door to door in one way or another, just to make sure that we get everybody vaccinated that we can. So there's a lot to do. Some people don't have all the knowledge about the vaccine. That's not uncommon. Some people are distrustful. So what we want to do with each and every person is just understand what are your issues of not getting vaccinated. Because the reality is we are all in this together. So if we don't get enough people vaccinated, it means that we don't have herd immunity, which means the virus is going to continue to go around in the community. And the nasty thing about this virus is its job is to keep living. And so when it sees its challenge, it mutates, it changes, it's trying to evade us. And as it mutates and changes, those mutations can get more dangerous, they get more infectious, and they can be more deadly. So that's why it's important for people to get vaccinated now, as quickly as they can. They can come here to Americana, for instance, today, or they can go to Cardinal Stadium in the purple lot there anytime. And yes, if you want to make a reservation, you can, but you can also just show up. I mean, literally now, between 9 a.m. and 6 p.m., Monday to Saturday, you can just get in your car and return to wherever you are, where you came from, and within 30 minutes, you would be vaccinated. It's as easy as that. So we're trying to make it easy. We're trying to make it accessible. And of course, we want to answer any questions that you have about the vaccine so you understand how safe it is. There's a lot of misinformation and disinformation about the vaccine, and we want to disabuse all of that. All of the medical community will tell you that everyone should be getting the vaccine, regardless of your condition, but especially if you're in a compromised condition from a healthcare standpoint. So let's say that you have a heart problem or a liver problem. It's even more important for you to get the vaccine, because if you got the virus, that virus will attack those weaknesses. So the vaccine gives you strength, and the vaccine helps you. If you're pregnant, you should get the vaccine. Some new studies are coming out that the newborns, when they're out, they have antibodies. We're not quite sure if they're having antibodies in terms of did they get it through the vaccine, did they get it through the placenta, but the kids are having it. So it's a gift that you can give to your newborn child before they're even appearing. So there's just all kinds of reasons why that you should be getting the vaccine. If you know of somewhere in the community that we should be administering the vaccine and we're not, please let us know. Okay, so think about our vulnerable populations, think about some folks that are more hesitant than others. we're having a particular challenge with the age group of 20 to 40 years old. And we're seeing a mini surge in infections with that particular category. So if you know where a large group of 20 to 40-year-olds are congregating and you think we should be doing a vaccination clinic there, we will do that. Delano, somebody said, are we going to the bars? Okay. Probably so before this whole thing is over. Okay. K&A will go to where the people are. I want to thank Delano Manson over here. She's the CEO of the Kentucky Nurses Association. K&A has been incredible throughout this whole vaccination effort from before day one with planning and administering the vaccine, part of our incredible volunteer corps that we've had to make this happen. So we'll be in the bars with the nurses administering shots before it's all over, and there is a rumor of a shot for a shot, just to incentivize people to get their vaccine. And if that's what it takes to get it done, then we'll get it done. Just one, okay? But we gotta have people to get the vaccine so we can all be safe, and your family is safe as well. I wanna thank Sabine Nassim. Sabine is here. She's our director of the Office for Globalization. Some of the folks that are foreign-born and are not, or they could be new Louisvillians, part of our refugee community, they've got a lot going on in their life, so they don't have as much information as other people do with the vaccine. So organizations like Americana and others that Sabine has identified and is working with, that's how we're getting our word out to our globalized community. We had an incredible event last week on Miners Lane with our goal was 300 of our Latino population, and 400 ended up signing up. So our foreign-born community wants to get the vaccine. We just got to inform them and make it easy for them. So Sabine, I really appreciate the work that you're doing in that area. Good job. So we're going to continue our extensive outreach into the community, but we need the community's help. Okay, so please contact us at 574-2003 or online and help us kind of figure out how we can get this vaccine to each and every Louisvillian. And again, Edgardo, to you and the entire team here, thank you for decades of great work, and thank you for helping us here today. Thank you to all of our wonderful volunteers and vaccinators out here and people that have showed up as well. God bless everybody. And now I'd like to introduce the fabulous director of Louisville Metro's Office for Globalization, Sabine Nassim.
So as the mayor mentioned, we'll be shifting away from LouVax's arena operations to mobile missions, where our goal is to reduce inequities and vaccination barriers for communities experiencing health disparities by tailoring our mechanisms to meet people where they are. Immigrant and refugee communities in the United States include over 40 million people representing hundreds of cultures. They are integral to the social, cultural, and economic vitality of our country. Yet many of these communities face a range of access-related barriers to obtaining the COVID-19 vaccine. That includes transportation, limited trust of government and the healthcare system, taking time away from work, and the difficulty of navigating a medical system for appointments, especially if their primary language is not English, and interpretation services are not offered. Overcoming these barriers requires direct engagement with communities, which entails collaborative efforts with organizations like Americana Community Center that have a trusted relationship with their community. Information must be provided in the community's primary language and in a culturally appropriate manner by a trusted source. This is why the Office for Globalization has made it a priority to ensure immigrant and refugee communities have access to accurate information in a language they can understand. And having COVID-19 educational handouts and vaccination registration forms for today that are translated in multiple languages specific to this part of the city. And thanks to our partnership with Family Health Centers, we are able to eliminate built-up fear by having a friendly face accessible to assist them in navigating through the process in their own language. Minimizing access barriers, providing targeted outreach and education, and alleviating fears are all possible because of strong collaborations with partners like Metro Health Department, Kentucky Nurses Association, Councilwoman Nicole George from District 21, and trusted community agencies like Americana Community Center and Family Health Centers that are working to ensure equitable access to our immigrant and refugee communities by successfully bringing vaccines directly to a place where they are comfortable.
So what everybody can do as a citizen then is do their part, and that means get the vaccine so that we are defeating it and pushing it away, and I'm protecting you if I get the vaccine and vice versa. So there is, I believe, a citizenship obligation to get this vaccine as well. It's a patriotic thing to do. The centralized place is louisvilleky.gov. So that's the Louisville City website, and then you go to the Public Health Department, or you could go to louisvilleky.gov/COVID-19, and all of the venues are listed there. We've got dozens of places in the community where you can get the vaccine right now.
The 20 to 40-year-olds, why aren't they getting the vaccine? Do you know why? Or there are three things they're saying they don't want it? What's the issue there?
Well, the 20 to 40-year-olds tell us, look, I'm healthy, I don't need it. Or they might say somebody's gotten it, it really wasn't that bad for them, so I'm ready to risk it, if you will. There's been some misinformation and disinformation around fertility. So you might hear, I want to have a child, but I don't want to get the vaccine because that's going to hurt. That's not true. As a matter of fact, it's beneficial if you're going to be the mom in particular. And then there's some macho stuff going on, look, I'm tough. But then some of the macho guys in particular, it's like, well, I hear it hurts you. I said, wait a minute, you're some big tough guy. Why are you afraid of a little needle? And then some folks will say, well, I've heard there's some secondary effects, from the vaccine. My arm might be sore, I might get the chills, something like that. The real important thing for them to remember is if they don't know anybody that's had the virus, and badly, like my wife had it for 13 days, I thought she was going to die. And we've lost over 1,070 Louisvillians right now. And so any type of little pain you might get from a shot is nothing compared to what this virus can do for you. So it's a combination of all those things that are coming together. So we want to kind of disabuse those notions so that they can get the vaccine and get healthy. We'll really appreciate y'all doing this. Edgardo, again, you're a global best practice that we really appreciate having here in our family of Louisville, and to all of our volunteers, thanks again. Great job, everybody. Thank you.